In a world where silent killers lurk, diabetes emerges as an unsuspecting accomplice, claiming 70% of its victims through cardiovascular disease, the world's top silent killer. Dive into the intricate dance of insulin and glucagon, vital players in glucose homeostasis. Uncover the far-reaching consequences of prolonged diabetes, from the heart to the skin. Join us as we unravel the mysteries of diabetes management and explore groundbreaking research on potential cures. Discover the power of lifestyle changes, your key to thwarting this silent adversary.
Welcome to Ageful Living. Join us on the Ageful Living channel, dedicated to all things relevant for those in their golden years and beyond. Life in our 50s and beyond is brimming with possibilities, and we're here to share our insights and experiences with you. Let's embark on this journey together and explore the richness of ageful living. Hit that subscribe button, and let's make these years truly golden.
Introduction. Although diabetes mellitus, type 2 diabetes, is not the top killer for seniors, the other top causes of death are in large part as a consequence of those who suffer from chronic diabetes. The buildup of plaque in arteries can occur long before clinical diabetes sets in, and this unnoticed progression contributes to a staggering 70% of diabetes-related deaths, making cardiovascular disease the primary cause of mortality in type 2 diabetic patients. It is important for seniors to take steps to avoid and handle this silent killer, including prevention, treatment, monitoring, and management of the disease. What is diabetes? Diabetes mellitus is a medical disorder characterized by impaired ability of the body to produce or respond to insulin and thereby maintain proper levels of sugar or glucose in the blood. The disorder is a major cause of morbidity and mortality, though these outcomes are not due to the immediate effects of the disorder. They are instead related to the diseases that develop as a result of chronic diabetes mellitus. These include diseases of large blood vessels, macrovascular disease, including coronary heart disease and peripheral arterial disease, and small blood vessels, microvascular disease, including retinal and renal vascular disease, as well as diseases of the nerves. 3 types of diabetes. The 3 main types of diabetes are type 1, type 2, and gestational diabetes. About 90% of people with diabetes have type 2 diabetes, occurring mostly in senior adults. The remaining 10% of people with diabetes have either type 1 or gestational diabetes. We shall, for the purpose of this video, focus on type 2 diabetes. How does diabetes happen? Glucose homeostasis is the process of maintaining a stable blood glucose concentration in the body. It is a critical part of normal physiology, as both hyperglycemia, high blood glucose, and hypoglycemia, low blood glucose, can cause damage to cells. The body has a finely tuned system to regulate blood glucose concentration, which allows it to store glucose when there is excess available, and to pull glucose out from its stores when needed. 2 hormones, insulin and glucagon, both produced by the pancreas, play a central role in maintaining blood glucose homeostasis. Insulin is produced by the beta cells of the pancreas and released when blood glucose is high, causing cells around the body to take up glucose from the blood, resulting in lowering blood glucose concentrations. Glucagon is produced by the alpha cells of the pancreas and released when blood glucose is low, causing glycogen in the liver to break down, releasing glucose into the blood, resulting in raising blood glucose concentrations. Maintaining blood glucose homeostasis is crucial for normal physiological function and overall health. What are the consequences of prolonged diabetes? Prolonged imbalance in glucose homeostasis means that the blood glucose level is either too high, hyperglycemia, or too low, hypoglycemia. This can affect various parts of the body and cause serious complications. Some of the parts of the body that are affected by prolonged imbalance in glucose homeostasis are: the brain needs a constant supply of glucose to function properly. If the blood glucose level is too low, it can cause symptoms such as confusion, dizziness, headache, seizures, and coma. If the blood glucose level is too high, it can damage the blood vessels and nerves in the brain and increase the risk of stroke, dementia, and Alzheimer's disease. The eyes. High blood glucose levels can damage the small blood vessels in the retina, the light-sensitive tissue at the back of the eye. This can lead to a condition called diabetic retinopathy, which can cause blurred vision, floaters, and blindness. Low blood glucose levels can also affect the eyes and cause blurred vision, double vision, or eye pain. The kidneys filter the blood and remove excess glucose and waste products. High blood glucose levels can overload the kidneys and cause them to lose their filtering ability. This can lead to a condition called diabetic nephropathy, which can cause swelling, high blood pressure, and kidney failure. Low blood glucose levels can also affect the kidneys and cause dehydration. Electrolyte imbalance and kidney damage. The heart pumps blood throughout the body and delivers oxygen and nutrients to the cells. High blood glucose levels can damage the blood vessels and nerves that control the heart, and increase the risk of heart disease, heart attack, and heart failure. Low blood glucose levels can also affect the heart, and cause irregular heartbeat, chest pain, and cardiac arrest. The skin protects the body from infection and injury. High blood glucose levels can impair the healing process and increase the risk of skin infections, ulcers, and gangrene. Low blood glucose levels can also affect the skin and cause sweating, pale skin, and coldness. Prediabetes, a condition where blood sugar levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes. It affects more than 1 in 3 American adults, and most of them are unaware of it. It increases the risk of developing type 2 diabetes, heart disease, and stroke. Causes and symptoms. Prediabetes is caused by insulin resistance, where the cells in the body do not respond normally to insulin. This leads to high blood sugar levels over time. Prediabetes has no clear symptoms, so it often goes undetected until serious health problems arise. Prevention and treatment. Prediabetes can be reversed by losing a small amount of weight, getting regular physical activity, and eating healthy. In the States, the CDC-led National Diabetes Prevention Program can help people with prediabetes make lifestyle changes to prevent or delay type 2 diabetes and other complications. Testing and diagnosis. A simple blood sugar test can determine if a person has prediabetes. It is recommended to get tested if one has any of the risk factors for prediabetes, such as being overweight, having a family history of diabetes, or belonging to certain racial or ethnic groups. Symptoms of diabetes. The symptoms of diabetes can vary depending on the type of diabetes. In general, common symptoms include feeling more thirsty than usual, urinating more frequently, feeling more hungry than usual, unexplained weight loss, blurry vision, fatigue, slow healing sores, frequent infections. Measurements. There are 3 broad measures. You should consult your healthcare provider what the ranges of these measures are. Fasting blood glucose. 2R plasma glucose, A1C percentage. A1C is a blood test that measures the average amount of glucose, sugar, in your blood over the past 3 months. It is also known as the hemoglobin A1C or HbA1c test. The result is reported as a percentage, and the higher the percentage, the higher your blood glucose levels have been. On average, an A1C test can help diagnose and monitor diabetes and its treatment. It is used to detect prediabetes, help diagnose type 2 diabetes, and get an idea of how well your management plan is working if you have type 2 diabetes or type 1 diabetes. Diabetic management focuses on controlling blood glucose through lifestyle modifications, diet, exercise, medications, insulin, oral hypoglycemics, and self-monitoring. Early diagnosis and preventive measures, like maintaining a healthy lifestyle, remain crucial in curbing its burden. This section is deliberately left short because you should be seeking your doctor's or healthcare provider's advice. Some current research. The latest research on a cure for diabetes mellitus is promising. Researchers at Harvard University have made significant progress in developing a stem cell-derived replacement therapy that could potentially change the medical treatment for people with type 1 diabetes. The therapy involves the use of embryonic stem cells to make functional pancreatic islets for diabetics. The cells will be their own insulin factories. In another study, researchers have identified an enzyme that blocks insulin produced in the body, which could provide a new target to treat diabetes. The study focuses on nitric oxide, a compound that dilates blood vessels, improves memory, fights infection, and stimulates the release of hormones, among other functions. Scientists have also discovered a pathway to the regeneration of insulin in pancreatic stem cells, a major breakthrough toward new therapies to treat type 1 and type 2 diabetes. In 2 newly published papers, researchers outline a new promising pathway to treating type 2 diabetes. While these studies are promising, it is important to note that there is no definitive cure for diabetes mellitus yet. However, these studies provide hope for the future of diabetes treatment. Lifestyle changes can help prevent or delay the onset of type 2 diabetes, especially if you have prediabetes or other risk factors. Some of the lifestyle changes that can help you avoid diabetes are losing extra weight. Being overweight or obese increases your risk of diabetes. Losing 5% to 10% of your body weight can make a big difference in your blood sugar levels and overall health. Eating healthy foods most of the time. Choose foods that are low in fat, sugar, and salt, and high in fiber, protein, and vitamins. Avoid processed foods, sweetened beverages, and large portions. Eat more fruits, vegetables, whole grains, lean meats, nuts, and legumes, being more physically active. Aim for at least 150 minutes of moderate to vigorous physical activity per week, such as brisk walking, jogging, cycling, or swimming. Exercise can help you burn calories, lower your blood sugar, and improve your insulin sensitivity. Quit smoking and limiting alcohol. Smoking and drinking can increase your blood sugar levels and damage your blood vessels and organs. These lifestyle changes can also help you manage your diabetes if you already have it. However, they are not a substitute for medical treatment. If you have diabetes or prediabetes, you should follow your doctor's advice on medication, monitoring, and checkups. Conclusion: Understanding diabetes mellitus involves grasping these foundational concepts and staying abreast of evolving research and treatment strategies. As the scientific community continues to explore diabetes, ongoing debates and discoveries will shape the future landscape of diabetes management. From your personal perspective, lifestyle changes would be the most accessible way to avoid or delay the onset of diabetes, because these are health-promoting and within your control. If you have detected pre-diabetic conditions at an early stage, you can still make efforts to reverse pre-diabetes.
If you're enjoying the video, give it a thumbs up. And if you haven't already, consider subscribing and hitting that notification bell. Join the Ageful Living channel. We'd love to have you. Your support means a lot to us. Hit the like button, hit subscribe, and let's keep this awesome community growing. Got any thoughts? Drop them in the comments. Thanks for being part of the Ageful Living community.